Although now proven to be a myth, chasteberry was believed to promote chastity by reducing sexual desire, hence its name. It's also been historically used in increasing lactation during and after pregnancy. However, these traditional applications have not been clinically investigated. Chasteberry is also known as Vitex agnus castus. It's the fruit of the chaste tree, which is native to Western Asia and southwestern Europe. The fruit is used as a dietary supplement for conditions like the menopause, infertility, menstrual problems, and a number of other conditions. It's also available as a capsule, liquid extract, tablet, and essential oil. It is now also being researched as a powerful dopaminergic nootropic. Chasteberry contains flavonoids. These are the plant pigments that are naturally found in a variety of nuts, fruits, and vegetables. These chemicals have anti-inflammatory, antioxidant, and antiviral properties. It has essential oils, and these are naturally occurring chemicals that give the chasteberry its odor and flavor. Blends of essential oils are frequently used in aromatherapy for their potential effects in decreasing heart rate and blood pressure. It also has anti-inflammatory compounds, the iridoid glycoside. These compounds have been reported to have similar effectiveness in treating inflammation as non-steroidal anti-inflammatory drugs, with far fewer side effects. Chasteberry increases dopaminergic activity in the brain. This results in a reduction of prolactin release in the body. When too much prolactin is circulating in the body, it can cause disturbances in the menstrual cycle, as well as a deficiency in level of estrogen in women and testosterone in men. However, these hormonal changes appear to be dose dependent. Low doses, 200 milligrams of chasteberry, can increase levels of prolactin and progesterone, likely by the inhibition of other hormones like follicle stimulating hormone and luteinizing hormone. Whereas at high doses of 500 milligrams of chasteberry, levels of prolactin may be decreased, with luteinizing hormone and follicle stimulating hormone levels being unaffected. Chasteberry may stimulate opioid receptors. Opioid drugs are medically used as painkillers, like morphine and codeine. Therefore, chasteberry may provide users with some pain relief by acting on similar pathways within the body. Chasteberry also stimulates the secretion of melatonin, a hormone that regulates the circadian rhythm, which is your sleeping patterns. In many clinical studies, chasteberry reduced a variety of PMS symptoms, including breast pain and tenderness, edema, constipation, irritability, depressed mood, anger, and migraines. In one trial on over 100 women with PMS symptoms, more than half of the patients that were treated with chasteberry over 6 days for 6 consecutive menstrual cycles experienced significant reduced breast pain and tenderness, edema, constipation, irritability, depressed moods, and migraines. In some cases, PMS symptoms can be caused by an excess release of prolactin from the pituitary gland. In other cases, it may be a result of an imbalance of estrogen to progesterone. High doses, 400 milligrams per day, of chasteberry may alleviate the PMS symptoms by reducing circulating prolactin in the body, which restores estrogen levels. Additionally, this reduces progesterone levels, normalizing the ratio of progesterone to estrogen. These hormonal balances may provide significant relief during PMS. The existing evidence suggests that the chasteberry may help with PMS symptoms. In Germany, chasteberry is used to treat luteal phase disorders. This is the second half of the menstrual cycle, which is usually shortened in women with the disorder. Luteal phase disorder is primarily caused by progesterone deficiency in the first phase of the cycle. Another menstrual cycle disorder, called amenorrhea, is the absence of menstruation. This may be caused by sustained hormone fluctuations, thyroid malfunction, pituitary tumor, premature menopause, and pregnancy. In both of these conditions, it's quite difficult and or impossible to become pregnant. Patients also experience a variety of other complications, especially in their PMS cycles. In a study of 96 women with luteal phase disorders, amenorrhea and infertility with unknown cause, Chasteberry increased pregnancy rates when compared to placebo. Pregnancy occurred twice as often in patients who consumed the Chasteberry over the period of 3 months. These effects were possibly mediated by normalizing the level of progesterone, which helps to achieve pregnancy by alleviating the progesterone deficiencies. Furthermore, women taking Chasteberry may experience a more regular menstrual cycle. In one study of 52 women with hyperprolactinemia, which is higher than normal levels of circulating prolactin, Chasteberry improved irregular periods and enhanced fertility. This was achieved by normalizing the levels of prolactin. Based on this mechanism, Chasteberry may be effective in the treatment of polycystic ovarian syndrome. Menopause marks the end of the menstrual cycle for women. This period is associated with a natural decline in female reproductive hormones like estrogen and progesterone. In the time leading up to the menopause, many women experience a variety of symptoms, including irregular periods, vaginal dryness, chills, night sweats, hot flashes, and dry skin. In 2 separate trials on 75 patients, most women suffering from menopausal symptoms who use the essential oils from the leaves and the fruits of Chasteberry reported strong symptomatic relief. Chasteberry increased progesterone at low doses of 200 milligrams in rat studies, which may be involved in reducing the symptoms of the menopause. In a 3-month study of 100 women with PMS and migraines, Chasteberry treatment reduced the frequency of monthly migraines by more than 50% in 42% of the patients. In addition, 57% of the patients that were given Chasteberry had more than a 50% lower frequency of monthly days with headaches. In a study, a spray developed from the seed extract of Chasteberry was successful in keeping away fleas, mosquitoes, ticks, and biting flies from humans and animals for a time period of around 6 hours. Additional research is warranted to confirm this preliminary finding. Endometriosis is when the uterine tissue lining, the endometrium, begins to develop outside of the uterus. It's generally caused by genetic factors or hormonal imbalances. A common symptom of endometriosis is heavy inflammation around the uterus, resulting in pain and increased bleeding during the menstrual cycle. Chasteberry may help reduce the amount of inflammation around the uterus by normalizing these hormonal imbalances, making the symptoms less painful. It may also relieve symptoms by decreasing pain and inflammation. In one rat study, a number of compounds in Chasteberry reduced pain, possibly by stimulating opioid receptors, and reduced inflammation in various parts of these animals. In cells, Chasteberry exhibited moderate anti-inflammatory activity also. A uterine fibroid is a non-cancerous tumour that develops in the uterus of many women. Most of the time, uterine fibroids are caused by hormonal imbalances, especially high levels of progesterone. Because of this, hormone therapy is commonly used to treat and shrink uterine fibroids. Since chasteberry reduces progesterone level, it may alleviate some symptoms of uterine fibroids. Increased bleeding is one of the key symptoms of uterine fibroids. In a clinical trial on 84 women with heavy bleeding in their uterus during menstruation, chasteberry treatment for over a period of 4 months significantly decreased bleeding, indicating that it may reduce increased menstrual bleeding from patients with uterine fibroids. One of the main causes of acne is hormonal fluctuation and imbalances, and these are more pronounced during PMS. As a result, many women experience acne before their menstrual cycles. Because chasteberry may normalize these hormonal imbalances by decreasing prolactin, it may treat premenstrual acne. Chasteberry may also treat premenstrual acne due to its antibacterial and antioxidative properties. In a cell-based study, gel extracts of chasteberry inhibited the growth of acne-producing bacteria. An enlarged prostate is also known as benign prostatic hyperplasia, or BPH, and it occurs in most men as they grow older. Although it's not cancer-causing, an enlarged prostate can significantly increase the risk of prostate cancer. The likelihood of prostate enlargement increases with age. Prostate cancer can occur once the prostate gland cells begin to multiply out of control. In the lab, extracts of chasteberry reduced the growth of cells and even stimulated the death of prostate cancer cells, indicating that chasteberry may be useful for prevention and the treatment of benign prostatic hyperplasia and human prostate cancer. For PMS, uterine fibroids, premenstrual acne, endometriosis, and female infertility, 400 to 500 milligrams of a standardized extract containing 0.05% agnus per day have been used in clinical trials. For menopause symptoms, low doses of about 200 milligrams per day were used in clinical trials. Agnus is the active ingredient found in the chasteberry, and powder extracts of chasteberry are generally standardized to contain 0.5%. If used in limited amounts, no more than 1,000 milligrams per day, this fruit tends to be very well tolerated, and there have not been many reported side effects. In rare cases, there's been reports of skin rashes and stomach discomfort, while there's also reports of increased menstrual flow. Don't take chasteberry during pregnancy, as this will cause hormonal fluctuations, which may have strong effects on an individual during this time. Drug interactions or contraindications with chasteberry are unknown. However, because it increases dopamine, it may interfere with drugs that affect dopamine levels. This would mainly apply to patients taking antipsychotic drugs and those who suffer from Parkinson's disease. These individuals should consult their doctor before taking chasteberry. Women taking other hormone-altering drugs, such as birth control pills, should not use chasteberry either. Hormonal changes caused by chasteberry interrupt the action of these drugs. Furthermore, if you have a hormone-sensitive condition, such as breast cancer, then chasteberry should also be avoided.